There's that moment in the mirror. You've done everything right since having kids. You eat well, you exercise, but your belly still won't go flat. And you start to wonder, is it me? Do I need another workout, another diet, maybe lipo? Or you've heard the word tummy tuck and you've thought, do I really need something that big? If that sounds familiar, you're not alone. For so many mothers, this is the most frustrating part of the post-pregnancy journey. You lose the baby weight, but your stomach still doesn't look or feel the same. You search for answers, liposuction, tummy tuck, skin tightening, and end up more confused than when you started. The truth is, every woman's body changes differently after pregnancy, and the right solution depends on what pregnancy changes and leaves behind. And once you understand that, every decision becomes clear. I'm Dr. Larry Fan, Harvard-educated, one of America's top plastic surgeons. For more than 20 years, I've helped thousands of women reclaim their bodies again, safely and beautifully. In this video, I'll show you 3 things: what liposuction and a tummy tuck really do and the difference between them, a new minimally invasive option that can help some mothers tighten skin without major surgery, and third, how to know which procedure your body actually needs. So before you decide between liposuction or a tummy tuck, we have to look beneath the surface to see what pregnancy changes and leaves behind in the layers of your abdomen. Once you understand those layers, every decision becomes clear. Most women look at their stomach and they see one problem, a bulge, but that's not the whole story. What you're seeing on the outside is often just a reflection of what's changed underneath. Beneath the surface, there are 4 layers that shape how your abdomen looks. First, the skin. Second, the fat just beneath the skin. Third, the muscles. And fourth, the deep internal fat behind the muscles. During pregnancy, the skin stretches, the muscles weaken or separate, and the fat layer often thickens, both under the skin and deeper inside the abdomen. That's why no single treatment fixes every belly the same way. Before we talk about procedures, let's clear up the one thing that frustrates almost every mother. You can be disciplined, you can be fit, and still have a belly that won't go away. And that's not your fault. Healthy eating, consistent movement are always the foundation. They shrink fat cells, strengthen your body, improve energy, but no amount of diet or exercise can tighten stretched skin or repair separated muscles. These tissues don't tone, they have to be restored. That's why, even when you're doing everything right, the belly still doesn't change. So what can actually fix it? Let's look at the 2 procedures that reshape these layers, liposuction and the tummy tuck. And they're often compared, but they actually do very different jobs. Liposuction removes fat only. Through tiny openings, a small tube called the cannula gently removes fat beneath the skin. It's done under light anesthesia. Recovery takes about a week. It sculpts, but it doesn't tighten or repair. It works best when your skin is firm and your muscles are strong. It shapes, but it doesn't rebuild. A tummy tuck or abdominoplasty goes deeper than liposuction. Begins with an incision low across the lower abdomen, hidden beneath the bikini line. Through that opening, the skin and fat layer are lifted from the muscles. The muscles, which are often separated during pregnancy, are brought back together with sutures, tightening and flattening the abdominal wall. And once the structure is repaired, the extra skin is trimmed away and the remaining skin is redraped smoothly, reshaping the waist and defining the contour. In most modern tummy tucks, liposuction is also performed, not only to remove stubborn fat, but to sculpt the waist and flanks so the body flows naturally from every angle. Think of it like restoring a sculpture. First you rebuild the framework underneath, then refine the surface until it's balanced and smooth. It's done under anesthesia, and initial recovery is about 3 weeks. The end result is a flat, firm, and beautifully balanced tummy. Now let's make this simple. To see which treatment fits your body, imagine your stomach as 4 layers, each with its own solution. The first layer is the skin, the outer covering that stretches and sags after pregnancy. When it's loose, only tightening or removal, like a tummy tuck, can make it smooth again. Beneath the skin is the subcutaneous fat, the layer just under the skin. That's what liposuction removes, sculpting and refining shape. Deeper still are the abdominal muscles. When they're separated, it creates a soft pouch or a bulge, and only a tummy tuck that repairs those muscles can restore strength and flatness. The deepest layer is visceral fat, the internal fat behind the muscles. No surgery can reach it. It changes only through fitness and metabolic health. When you match the right solution to the right layer, that's when results look smooth, strong, and naturally balanced. So what if you're in between, not ready for a tummy tuck, but wanting more than liposuction? That's where modern, minimally invasive options come in. A lot of women tell me, I don't think I need a full tummy tuck, but I still want to look better. They want meaningful improvement without a long scar, weeks of recovery, and the fear of major surgery. There's a third option many women don't know about, a minimally invasive skin tightening procedure that sits between liposuction and a tummy tuck. It delivers more tightening than liposuction alone, but without the incisions or muscle repair of a full tuck. The procedure begins like liposuction, removing unwanted fat through tiny openings. Then, using advanced tools such as Renuvian plasma or body-tight radiofrequency, we deliver controlled energy beneath the skin. That energy gently heats the tissues, causing it to contract and stimulating new collagen, tightening the skin from the inside out. Sometimes, I also treat the surface with radiofrequency microneedling or laser to firm the outer layer. Together, these techniques smooth and tighten the abdomen, and not as dramatically as a tummy tuck, but noticeably. It's usually done under light anesthesia, and most women can return to normal light activities within a week. Results appear gradually as swelling fades, collagen rebuilds over several months. But it's very important to understand the limits. These treatments help when your skin still has elasticity and your muscles are strong. If your skin is loose, or if your muscles have stretched, which a lot of mothers experience, only a tummy tuck can fully flatten and tighten the abdomen. So this minimally invasive option works best for women who want less downtime and are comfortable with a smaller degree of improvement. For many mothers, the most complete and lasting results still come from a tummy tuck combined with liposuction, because that's what truly restores both the structure and the surface. Now, with all these options, it's easy to feel overwhelmed. So how do you know which one truly fits you? The best result isn't about doing more, it's about doing what's right for your body. Now that you know what each procedure does, liposuction, minimally invasive skin tightening, and tummy tuck, the real question becomes, how do you know which one your body truly needs? This is where most women get stuck. They've read articles, watched videos, compared photos, and still feel uncertain. So let's make this simple and personal. For most mothers, this isn't just about removing fat. It's about tightening skin, repairing muscles, and restoring a flat, firm abdomen with a sculpted waistline. It's about reclaiming your body, feeling strong, confident, and comfortable again. And the first step is understanding what your body is actually telling you. So let's start with something that I call the mirror test. It's a quick 3-step way to see what's really happening beneath the surface. Because when you can see what's causing the problem, you'll instantly know which procedure makes sense for you. Step 1, the pinch test. Pinch the skin around your belly button. If it's firm and bounces back, liposuction may be enough. If it's loose or folds easily, you'll need skin tightening or removal for a smooth result. Step 2, the muscle test. Lie on your back and lift your head slightly. If you feel a ridge or a gap down the middle, that's muscle separation, and only a tummy tuck can bring those muscles back together. Step 3, the layer test. If your belly still feels full, even when the outer fat is gone, that's visceral fat, deep fat behind the muscles. And that changes only through fitness and metabolic health, not surgery. This isn't about diagnosing yourself. It's about understanding your body so you can have a more informed conversation with your surgeon. Because once you know where the problem really lives, the right solution becomes obvious. Now that you've seen what your body is telling you, here's how that understanding translates into a simple plan. If your skin is tight and your muscles are strong, if you're bothered by extra fat that won't go away, liposuction is probably the best choice. It removes fat and smooths your shape beautifully. If your skin has just a little looseness, but your core is still firm, then liposuction combined with energy-based tightening, treatments like Renuvian or Body Tight, can firm the surface while sculpting the fat underneath. Now, if your skin is loose, or you have that soft mommy pouch from stretched muscles, that's where tummy tuck with liposuction makes the biggest difference. It repairs the muscles, removes extra skin, and reshapes the waistline for a smooth, natural contour. And if your belly still feels full, even when you're lean, that's visceral fat, the deeper fat behind the muscles. No surgery can reach it. That's where metabolic health, nutrition, and fitness make the change, not the operating room. The right choice depends on where the problem lives, in the skin, the fat, the muscles, or deeper. When you match the treatment to the cause, everything makes sense, and the results look beautiful, balanced, and effortless. And if you're leaning toward a tummy tuck, one of the most common fears I hear about is surgery itself, the pain, the recovery, the scar. And those fears are valid, but here's the truth. The discomfort from surgery is real, and it's temporary. Recovery is tough for a few weeks, but almost every woman tells me the same thing afterwards. It was so worth it. And the scar fades, but the confidence and the strength last for years. Pain passes, confidence stays. You deserve to feel good in your own body. You deserve to look in the mirror and see a version of yourself that feels strong, capable, and whole. This isn't vanity, it's self-respect. When you take care of yourself, you take better care of everyone you love. So by now, you can see that the right procedure isn't about doing more, it's about doing what's right for your body. And when you understand that, clarity replaces confusion and confidence replaces fear. And that's the moment transformation can begin. Now you understand the difference between liposuction, a tummy tuck, and everything in between, and how to match the right approach to your body. But here's what still worries most women. How do I make sure my results look natural and not tight or pulled or fake? In my next video, I'll show you why some tummy tuck results look natural, what can go wrong, and how to make sure your tummy tuck looks effortless, balanced, and beautifully you. Watch the next video why some tummy tucks look fake and how to get a natural result. If you're ready for personal guidance now, apply for your personal aesthetic roadmap session at 77plasticsurgery.com. This is a one-on-one consultation where we'll evaluate whether you're a candidate, design a customized plan for your anatomy, your goals, and your comfort so you can move forward safely, confidently, and beautifully. Because transformation is about changing who you are. It's about bringing your confidence back to light. I'm Dr. Larry Fan. As always, stay beautiful and stay fantastic.